Good morning, everyone. I am Jumen Lastre, with the AFA-9 student. Today, I am going to report my assigned topic. So, let's start. Okay, the telluriosis. A telluriosis is a group of tick-borne disease caused by telluria or the SPP. Both telluria and babesia are the members of the suborder Plasmorrhina. Babesia are primarily parasite of red blood cells or the telluria use successively white blood cells and red blood cells for completion of their life cycle and mammalian host. Sporocyte is the infected sporocyte stage of the parasite is transmitted in the saliva of infected ticks as they feed. And the most pathogenic species of Telluria, example the T. farba and T. annulata parasite, multiplication occurs predominantly within the host of white blood cells, whereas less pathogenic species multiply mainly in red blood cells. Let's proceed to the development of the season stage of pathogenic Telluria causes the host white blood cells to divide at each cell's division. The parasite also divides, and mortality in such stocks is relatively low, but introduced cattle are particularly vulnerable. So, unlike in babesiosis and filariasis, there is no evidence of increased resistance in calves less than 6 months. East Coast fever is an acute disease of cattle. It's usually characterized by high fever, swelling of the lymph nodes, dyspnea, and high mortality, caused by Telluria parva and transmitted by tick vector, Rhipicephalus appendiculatus. It is a serious problem in East and South Africa. Etiology and transmission. The word etiology, it means the origin or cause of a disease or condition. So, the transmission is the spreading of passing along the transmission of a disease. Buffalo or the sinciroscapher is an important wildlife reservoir of T. farba, but infection is asymptomatic in buffalo. So, the T. farva, transmitted by ticks from either cattle or buffalo, caused severe disease in a cattle. Example of severe disease in cattle is anthrax, that is highly infectious, and fatal disease of cattle. It can cause acute mortality in ruminants. But buffalo derives parasite differentiate purely to roostoids, and cattle and generally are not transmitted by ticks. So, buffalo tifarba are maintained as separate population. So, buffalo tifarba were previously considered as a separate subspecies. So, the tifarba is usually highly pathogenic, causing high levels of mortality. T. farba sporocytes are injected into cattle by infected vector ticks. An occult phase of 5 to 10 days follow before infected lymphocytes can be detected in gem-sustained smear of cells aspirated from the local draining lymph node. The number of parasite cells increases rapidly throughout the lymphoid system, and from about day 14 onward, cells undergoing merogony are observed. From the word merogony is a form of sexual reproduction, whereby a parasitic protozoan replicates its own nucleus inside its whole cells and then induces cell segmentation. This is associated with widespread lymphocytolysis, marked lymphoid depletion, and leukopenia. Pyroplasm in red blood cells infected by the resultant merozoites assume various forms, but typically they are small and rod-shaped or oval. Clinical signs is vary according to the level of challenge and range from an apparent or mild, severe, and fatal. Typically, fever occurs 7 to 10 days after parasites are introduced by feeding sticks, lymphoblasts, in gym-system smears of needle aspirates from lymph nodes contain multinuclear cytosol. Anochoria develops and the animal rapidly loses condition, lacrimation and nasal discharge may occur. So, terminally, dyspnea is common. Just before date, a sharp decrease in body temperature is usual and exudate force from the nostril. Death usually occurs 18 to 24 days after infection. So, the most striking post-mortem lesions are lymph node enlargement and massage, pulmonary edema, and hyperemia. Hemorrhages are common on the serosal and mucosal surfaces of many organs, sometimes together with obvious areas of necrosis and the lymph nodes and thymus. So, anemia is a major diagnostic sign as it is in baby juices because there is minimal division of the parasites in red blood cells and thus no massage destruction of them. Animals that recover are immune to subsequent challenge with the same strains but may be susceptible to some heterologous strains. Most recovered or immunized animals remain carriers of the infections. Treatment and control. Treatment with farbacone and its derivative bufarbacone is highly infected when administered in the early stages of clinical disease, but is less effective in advanced stages in which there is extensive destruction of lymphoid and hematopoietic tissues. The components for this procedure are a cryopreserved sporozoite stabilate of the appropriate strains of Theileria derived from infected ticks and a single dose of long-acting oxytetracycline given simultaneously. Also, oxytetracycline has little therapeutic effect when administered after development of disease. So, it inhibits development of the parasite when given outside of infection. A cattle should be immunized 3 to 4 weeks before being allowed on infected pastures. So, parasites, bovine cells containing the zone stage of T. farba and T. annulata can be cultivated in vitro as continuously growing cells line. In the case of T. annulata, cattle can be infected with a few thousand culture cells. Attenuated strains produced by serial passage of such culture from the basis of live vaccine used in several countries, including Israel, Iran, India, and the former USSR, the Union of Soviet Socialist Republics. Incidence of East Coast fever can be reduced by rigid tick control, but this is not feasible in many areas because of cost and the high frequency of acaricidial treatment required. So, acaricides are pesticides used to kill ticks and mites. Ringworms. This is the most common infectious skin disease affecting beef cattle. It is caused by a fungus and is transmissible to man. Typically, the disease appears as crusty gray patches, usually in the region of the head and neck, and particularly around the eyes. As a first step in controlling the disease, It is recommended that whenever possible, affected animals should be segregated under pens or stalls, clean and disinfected. Clean cattle which has been in contact with the disease should be watched closely for the appearance of lesion and treated promptly. Proper nutrition, particularly high levels of vitamin A, copper, and zinc, while not a cure, will help to raise the resistance of the animals and in so doing offer some measures of control. Using a warmer like Evomic will kill lice and help prevent cattle from scratching, causing skin damage, and a place for the fungus to enter. Milk fever. Fever, also known as parturiente hypocalcemia and parturiente paresis, is a disease which has assumed considerable importance with the development of heavy milking cows. Decrease in the level of ionized calcium in tissues fluids is basically the cause of the disease. In all adult cows, there is fall in serum calcium levels with the onset of lactation at calving. The disease usually occurs in 5 to 10 years old cows and is chiefly caused by a sudden decrease in blood calcium levels, generally within 48 hours after calving. Symptoms. Symptoms in classical cases, hypocalcemia is the cause of clinical symptoms. Hypocalcemia, characterized by the decrease in blood calcium below normal level, is the one of the most common disorders affecting dairy cows at the onset of lactation. Hypophosphatemia and variation in the concentration of serum. Magnesium may play some subdiary role. The clinical symptoms develop usually in 1 to 3 days after calving. They are characterized by loss of appetite, constipation, and restlessness, but there is no rise in temperature. A calf score. Calves may develop scores due to bacterial or virus infections. Scores is known as calf score or neonatal calf diarrhea. The primary causes of scores include rotavirus or the coronavirus, Cryptosporidium parvon or the salmonella, and determine if treatment is required. Calves that are moving around in the pasture with their tails up probably do not need treatment. Check to see if the diarrhea is yellow or white. If this is the case, treatment is probably not needed. Determine if the calf is looking restless. Calves that are lethargic or not. Participating must in the playful activities with other calves are a red flag to pay attention. To calves that are also losing conditions are also cause for alarm. Check to see if the calves is dehydrated, or you can check for dehydration by pulling on the calf's neck skin. If the skin tints, this is a sign of dehydration. Then determine the calf's body temperature. A normal body temperature ranges. Anything outside of this range is a sign for treatment. Separate the sick calf or calves from the healthy herd. Administer fluids using your veterinarian-approved electrolyte solution. You may need to inject the fluids via IV or orally. Follow appropriate nursing care protocol using your vet's guidelines. This may include providing shelter, feed, and a warm place to sleep. A throwback from providing shelter is maintaining infectious control. All you have to work extra to get rid of soil, bedding, and disinfect everything that a calf will touch, from the floor to the fence panels and even the feed buckets. So, in event practice, there is the ingredients needed: pasambu or Acorus calamus leaves, 2 numbers dried gingers, gingiver officinalis or the 50-gram, or the guava pisidium, guajava, tender leaves 200 grams. The above materials are ground and made into a bolus and administered orally 1 or 2 times.